Greetings all, welcome to the new semester. This is Epidemiology and Community Health, and my name is Matthew Sovell. I apologize about the Collaborate session tonight. Collaborate didn't want to seem to cooperate this morning with me while I was trying to load everything up, so hopefully this will suffice, at least for this week. It's a picture of me and my son. It's actually about a year old now. He looks a little bit bigger now. That was up at Hershey Park in Pennsylvania. Not far from about 40 miles outside of Philadelphia. That, for those of you that have never been to Philadelphia, that is a picture of St. Joseph's University, that top picture there. I've been teaching this course at St. Joe's since 2011. So I've had the opportunity to teach it quite a number of times, and I've been able to refine the course over the past couple years. In addition to teaching at St. Joseph's, I also do some work for a couple community colleges. Montgomery County Community College out in Bluebell, Pennsylvania. I do some online work for Harrisburg Area Community College. And actually, just this year, I'm going to start teaching at Ursinus College, which is in Collegeville, which is, in fact, right where I live in Collegeville, Pennsylvania. In addition to teaching and a few other things, I spend a lot of time. There's a local organic produce farm right near our house, and I spend a lot of time there. I do a work share, so I go there, work for 4 hours a week, and I get all my food for free, all my produce for free. It's a great deal. It's important for us to remember as public health folks that the leading cause of morbidity and mortality in the United States is poor diet, lack of whole plant food, and or not enough whole plant food in our diet. So it's, as a public health person, I think it's really important to really promote the consumption of whole plant food as much as possible. So again, in addition to teaching and farming, I do some coaching as well. I'm a rugby coach. This is a picture of the Ursinus women's team. This is a team that I've been coaching for the past couple of years. The picture on the right is them in their prom dress game. Every year they get dressed up in prom dresses and go out and play a full rugby game. It's really hilarious. Again, the main reason I got involved in this is because of the epidemic of head injury. That was my main concern. So we do what we can to try and eliminate concussions as much as possible, or certainly identify them and treat them whenever they come up. So I did my undergraduate work here at St. Joe's. I did a chemistry degree. I did not play for the rugby team, but that is a picture of the St. Joe's rugby team. And then I did my graduate degree at Westchester University. Westchester is, I don't know, maybe 30 miles outside of Philadelphia. It's a state school. And I did my degree, obviously, in public health. While I was finishing up my degree at Westchester, I was working at Merck. I spent about 20 years working in industry before I jumped over to teaching full-time. And I was making the chickenpox vaccine, the varicella vaccine. It's actually varicella and zoster. Zoster is the shingles, and varicella is the chickenpox, but it's actually the same virus. And it's the same vaccine that's used for both. It's different concentrations. So I did my graduate thesis with Merck's epidemiology department. It was a great opportunity, and fortunately, one of the faculty members at Westchester was friendly with the lead epidemiologist at Merck, so I did some work with there. That's the title of my thesis: a quantitative systematic review of varicella zoster virus in immunocompromised populations. So immunocompromised populations are folks like HIV, lupus, things like that. So people that have their immune systems compromised, bone marrow transplant, solid organ transplant recipients, and varicella and zoster are both problems in those populations. So they did get a weakened and inactivated form of the vaccine approved for use in some of those populations, which is kind of cool. And then I also did some work for GSK too before I started teaching full time. Play a little guitar, not very good, but it's nice and relaxing. Spend a lot of time in the kitchen cooking up food for my family, all those fresh vegetables, and I like to spend a lot of time outdoors hiking as well. So one of my favorite analogies about public health and epidemiology is that if you can imagine that doctors and nurses are saving people's lives by pulling them out of the river, then the epidemiologist is upstream trying to figure out why people are falling into that river in the first place. And there's a lot of different reasons, for that, but all these different public health programs are essentially aimed at keeping people out of the hospital, keeping people safe and healthy. So waste disposal, water treatment, obviously having clean water is very important. Vaccination programs, of course, nutrition programs, which I'm involved with the farm. STD prevention programs, you hear about those a lot, especially with public health groups that are working in major cities. like Philadelphia, and of course, drug and alcohol abuse prevention. These are just a very small list. We're actually going to take a look at quite a few really cool public health programs out there. Um, so why is this important? We're just now really starting to get the idea that we're spending all of our money treating conditions that are preventable. We spent about $3 trillion last year in healthcare, and about 75% of that is spent on non-communicable chronic conditions: cardiovascular disease, cancer, diabetes, and COPD, emphysema, respiratory illnesses, upper respiratory illnesses. Um, and 95% of all these diseases are preventable with lifestyle choices. So if the four main modifiable risk factors were eliminated, which include smoking, alcohol, excessive alcohol, poor diet, and lack of physical activity, about 90% of that chronic disease would be prevented. So this is why education is important, and educating people about how to be healthy is one of the main aspects of the Affordable Care Act. So they're really starting to push this idea now. In public health, this is a great, great time to be in public health. Um, so this is what I do. A lot of my undergraduate courses are aimed towards basically disease prevention. Healthy living 101. Core elements of health and wellness. And this is what I always start out with. One of the classes I actually teach is called Holistic Health, and it's about complementary and alternative medicine. And a lot of the students are a little disappointed because they show up to class and I spend most of my time talking about how they're supposed to eat right and exercise. They want a magic bullet. They want a nutritional supplement or an herb or something like that that's going to take away all their problems, and it doesn't work that way. Trust me, I do. I looked at all the evidence for all these different forms of medicine, and this is really what you need to do: eat a very healthy diet, get an appropriate amount of physical activity, learn how to effectively manage your stress, and then a healthy environment is important too. So that could be like secondhand smoke, or it could be climate change or things like that, air pollution. But it's also just the environment that you live in. Is it very stressful? Um, Most of the people in the military coming back from war suffer from PTSD. So that is a very dangerous environment for mental health. Prison is the same way. So the environment can be a few different things there. So sometimes I call that the holistic circle, or a couple different names for it. So we're going to take a brief look at some public health programs before I jump into the syllabus. Um, these are just some programs that have been going on out there. This is one of my favorite. This is a program that's been done by National Geographic, and they got together a bunch of epidemiologists from Harvard and some other sources, and they looked at, it's called the Blue Zone Project. So the Blue Zones are areas of the world that have the highest life expectancy, the lowest rates of cancer, the lowest rates of cardiovascular disease, and the lowest rates of dementia. Okay, so these are the healthiest people in the world. Um, this has 5 places. If you go to their website, they have a few more places. But Okinawa, Japan, Japan traditionally has one of the highest life expectancies in the world, but especially that island of Okinawa. We've all heard of the Mediterranean diet. Harvard really pushes the Mediterranean diet. So places in Greece and Italy have very long life expectancies. There's a little peninsula in Costa Rica. I don't know how to pronounce it actually. Nico, yeah, I'm sorry, whatever that is. That has a very, very high life expectancy, and it's kind of cool. They just look at the lifestyle um, of all these different folks, and they're all unique. They all have different cultures, but they all have similarities. They all eat mostly whole plant food. It's about 95% whole plant food, so it's not vegan, it's not vegetarian, but it's mostly vegetarian. They have a little bit Okinawan. The Okinawans love pork. They'll cook pork in a pot, all day long, strain off all the fat, and just have a small amount of pork. And like I said, it accounts for about 2 or 3% of their diet. The rest of it is whole plant food. Um, they move naturally. They're not in gyms lifting weights. They're just fishing or gardening. They're just moving around moving naturally. They have a very positive outlook. They are very close with their family. And they all just have a very positive outlook on health. It's kind of cool. We'll talk more about that later in the semester. This other one is another one of my favorites. This is started by an epidemiologist named Gary Slutkin, who spent the first 10 years of his career, maybe more than that, fighting epidemics in Africa, epidemics of infectious disease. Came back to Chicago, where he was originally from, ready for a break, And what he found was an epidemic of gun violence, of shootings among kids. And he applied the same epidemiological principles that he used to fight infectious disease, but he used these same principles to fight violent crime. And it's been a very successful program. So I encourage you to check that out as well. Really cool, and it's a little controversial because they're treating violence like a disease instead of just throwing people in prison the way that we've been doing it. The industrial prison complex um, is profiting off of keeping people in prison. The problem is it doesn't work. It hasn't worked for a long time, and these types of public health programs actually do work. And there's a whole movie made about this. It was called The Interrupters. The Interrupters, what Dr. Sletkin did was recruited people from the local neighborhoods, people that had street credibility, and trained them to work as social workers and put them out in the streets. And it was the interrupters themselves that did most of the work here in reducing this violent crime. There is a program in Philadelphia for this now. Another really cool program is called Dairies for Berries. Um, Finland, following World War II, Finland had the highest rate of cardiovascular disease in the world. What happened was all the soldiers retired, came back from the war, and the Finnish government, basically gave them a plot of land because they didn't have any money to give them, and they weren't farmers, so they didn't know what else to do. So they went out and got a bunch of pigs or cows and just raised meat. So very heavy meat consumption in this area, and it was one particular area in Finland. I forget exactly where it was. So they were identified as having the highest rate of cardiovascular disease in the world. So a grassroots public health campaign was launched, educating the public about reducing their saturated fat, basically. And instead of having a big bowl of stew filled with meat, they would reduce some of the meat and throw in some vegetables, potatoes and carrots and things like that. It was kind of before that. The people in this area thought vegetables were just for the farm animals. They never ate vegetables themselves. So they cut back on the meat consumption, increased the vegetable consumption, and the saturated fat level, or excuse me, the cardiovascular disease decreased significantly. EPOD, I don't know if I'm pronouncing this right, but I think I am, as the world's largest obesity prevention program. Primarily in Europe, but the cities that adopt this program have about half the obesity rates of neighboring towns. So again, another one that I encourage you to check out. They do have EPOD here in the United States. It's not nearly as successful as it has been in Europe for a variety of reasons. I'm not exactly sure why. Probably because the westernized diet is so embedded here, the standard American diet, that it's kind of hard to reverse it here. And then the China study. This is what the New York Times referred to as the Grand Prix of epidemiology. It was the largest nutritional study ever conducted, one of the largest nutritional studies ever conducted. And it was conducted by Dr. Campbell, a biochemist out of Cornell. Cornell is really big about promoting plant-based nutrition. And one of the main reasons was because of the China study. And basically what they concluded was that eating fruits and vegetables is good for you, and eating lots of animal products is not good for you. And basically, if you can get the percentage of your calories from unrefined plant foods as much as possible, then you basically eliminate your risk of cardiovascular disease and probably cancer too, or at least you significantly reduce your risk of those diseases. So that's primarily what they found. So just a quick few, some of the cool, public health programs that are going on out there, and we're certainly going to be taking a look at many, many others. So just want to look at our syllabus real quick, kind of go through this. Just this basic course of epidemiology and public health. This is the textbook that we're going to be using. Hopefully you had a chance to get it. If you didn't, just let me know. In this first week, we can let you slide on getting that test in on time. But we want to make sure that we get everything on time moving forward. I will have some additional supplemental resources available as well, and I'll put these links to the website or links to the websites into Blackboard. One of them is the CDC manual. I'll explain that in a little bit more detail. That's just for basically extra help in your final paper. And I will be reviewing some of that as well. So the Collaborate sessions will be conducted weekly. Try to participate. If you don't, try and log in and make sure that you review the recordings. Okay, here's the scores. I think everything's pretty standard as far as the activities and the assignments. We're going to have discussion boards for the first 5 weeks. We're going to have a total of 7 tests. They're all online. They are timed. They're true, false, multiple choice. There might be a couple fill in there. Um, uh, so, you obviously open book, but I would strongly urge you to read everything before you actually try to take the test, because too many people try and think that they can sit down with the textbook having never opened it and try and take the test. It doesn't work that way. The human subjects training, I think that's week 6, week 5 or week 6, I forget. There are instructions on how to access that. That training takes 3 to 4 hours to complete. So make sure that you log in early, and you can log in multiple times. You don't have to do the whole 4 hours at one shot, but I would recommend that you try and knock that out as soon as possible. That's basically like an institutional review board kind of training on, appropriate activities with human subjects when you're doing research, which is going to be kind of important because we're developing a public health intervention, which is going to be designed to help human subjects, obviously, unless, of course, you're looking at veterinary medicine, if that happens to be your thing, which I have never had anybody do veterinary public health, but you're certainly welcome to if that's your topic, your thing. Again, I strongly recommend that. I forget, somebody said that they're involved in dental care or dental health. Do a public health intervention designed towards dental hygiene. That's great. Whatever you have a personal or professional interest in, that's what I would suggest that you try to design your public health intervention around. And again, I'll talk more about that in a few minutes. Here's the schedules that we're going to be taking a look at, the assignments. I also have the assignment due dates somewhere, which we'll take a look at in a few minutes. So this week, we're talking about measuring population health. We're going to go to the CDC website, or you're going to go to the CDC website and take a look at the health of your local population, wherever you happen to live. Then we'll get into how the public health system works within the health system and then the government. Talk about community health, emergency response, the public health workforce, all the different people, the different types of jobs that are in public health and epidemiology, environmental health. And this last week, as I said, what we're going to do is everybody's going to put together their own public health program. You're going to design a public health program. This is almost like a research proposal, but you're going to do like a public health proposal, and you're going to write it up, develop this plan, including an evaluation to see if to demonstrate that your plan is successful, and then you're going to present it to the class as if we are the stakeholders involved and you're trying to sell this intervention to us. Okay, and I think the rest of this is pretty straightforward. Feel free to read through that on your own. And then I think the last thing I wanted to do real quick, here's the assignment due dates. There you go. Try and get everything on time. I am, understand everybody has work and everybody's trying to do things. So do what you can to get everything in on time. I do reserve the right to deduct points for each day that an assignment is late. But if you give me a heads up beforehand, usually I'm kind of flexible. I like to have everything graded and grade center updated by Monday evening, following a Sunday night submission. So, hopefully on August 31st, if there is an August 31st, I'll have everything graded from test 1 and week 1. So trying to keep up with the work as much as possible. And then I just wanted to go through, if I can find the right ones. Here we go. So this is the presentations directly from the textbook. So again, I'm not going to read through all these, but feel free to pause this at any time and read through the chapter objectives. I'm not going to go through all these because you're going to be using this as a book. There are just a couple things that I wanted to mention about this. Again, read through all the book about the history of public health, kind of how it was developed. My favorite story is the one about John Snow fighting the cholera epidemic. But there are some really great and interesting stories there. As far as the errors in U.S. public health, battling epidemics prior to 1850 up until 1950, building the infrastructure, the public health infrastructure, It says up until 1990, filling the gaps in medical care delivery. We're still trying to fill gaps in medical care delivery. I don't know why that should probably be ongoing. And then after 1990, preparing for and responding to community health threats. Um, and the community health threats can be anything from STDs. As I said, poor diet is by far the leading cause of morbidity and mortality in the United States. But smoking is always an issue. And just because something is the leading cause of death, that doesn't mean that there's other things that are also important. Um, Percentage improvement in selected measures of life expectancy. So this is just kind of how we've been improving, at least in certain areas. Certainly, our life expectancy has improved. Um, Infant mortality rate has improved. So there's just a few other things. We haven't made much progress with cancer. Some cancers we have, and others we can't. We haven't. We'll talk more about the epidemiology of cancer later this semester. Infectious disease rates. So we know that in 1900, most people died from infectious disease, tuberculosis, influenza, things like that. 1919, I think it was, we had the influenza pandemic following World War One. And then it was during World War One. I'm sorry, it was all those men being kind of held together either in trains or in barracks, things like that. And one of them would get influenza, and the influenza just went all over the place. So you can see that the infectious disease had been decreasing significantly even before vaccines were in use in 1960. And that was mostly because of a variety of things. Clean water, sanitation, the use of toilets was extremely helpful. Probably the most important public health invention ever is the toilet. It sounds kind of funny, but it's true. Um, and of course, vaccines are important. I don't want to give that message, but healthy eating and toilets, public sanitation were probably more critical, or at least as critical. Um, Talk about again. I'm not going to read through all these. These are just some definitions of public health from different sources. We will be looking a lot at the Institute of Medicine, which is part of the National Academy of Sciences, quite a bit. It's a wonderful resource. And there's some really cool pictures here of the social ecologic model, which I want to kind of talk about in a minute. Public core functions in public health, as far as assessment, that's again what we're going to be doing this week when you go to the CDC website. Monitor health, try and diagnose and investigate into why these epidemics are breaking out, and then inform, educate, empower people. If you're talking about an epidemic of heart disease, which we have in this country, educate people about, hey, eat less saturated fat, eat more fruits and vegetables, and you'll be less likely to die from those diseases. Mobilize community partnerships, develop policies, and then as far as this is really where the government comes in, enforce laws, provide care, assure a competent workforce, especially for the public health, the medical folks, the nurses, doctors, make sure that they are competent, and evaluate the effectiveness of treatments and public health interventions. This is the one I wanted to talk about, social ecologic model. So the idea here is that when you're talking about health or health and wellness or disease, we can't just look at the individual. That, of course, is where it starts, the individuals, their age, their gender, their DNA, their genetics, their race, other biological factors. And then on top of that, their behavior. Do they smoke? Do they drink? Do they exercise? Do they eat right? On top of that is their social interactions, their interpersonal relationships. Do they have a strong support system? Is their family all smokers? Are they all overweight? Do they drink a lot? Or do the family have a relatively healthy outlook? We know that if both of your parents smoke, there's about a 90% chance that you're going to take up smoking. Same thing with drinking and healthy and eating. So we tend to pick up the same health behaviors that our family does. And not only that, but having a strong social network is extremely important, just to navigate through difficult sections of your life. When you don't have that, people tend to use drugs and alcohol as support rather than social support. Living and working conditions, obvious reasons. We've made some huge strides in working conditions in the United States over the past 50 to 100 years, which has been fantastic. It's been wonderful. The only problem is they're exporting all the jobs over to other countries where they don't have really good working conditions because the people are getting paid peanuts. And, this is part of the problem. So it's great here, but it's not good in other places. And then this last one, social, economic, cultural health, environmental conditions, all at the global, national, state, and local levels. So the public policies that the government provides, the policies that the school provides. Are your schools actually feeding your kids healthy foods, or are they like most schools and they just have a lot of junk food in them? Unfortunately, that's been a big problem. So there's all kinds of things that influence health. It's not just genetics. There's all different influences over health. I think I'm going to skip over this one. And there's some of these are great. And again, feel free to read through these on your own. I don't have enough time to go through all these. Public health people love these logic models, which is why we're doing these for our final paper, for our final project. You're going to develop a logic model. I would suggest that you Google or just search for other logic models to get ideas on how to develop or how to lay out your logic model. We're going to do a whole logic model on ourselves, but basically you're looking at the inputs, the processes, and then the outputs and the outcomes. And you're kind of creating this flow chart to develop this logic model. So we'll talk more about logic models. And again, I have plenty of examples of these. Again, I think I'm going to, this is probably pretty important. Features of public health. Social justice is really important. If that happens to be something that you're concerned about, I would suggest that you check that out, that area of public health out. We know that poverty has a huge role in health. In fact, one of the guys from Harvard likes to say that your zip code is more important than your genetic code when it comes to your health, because your environment, and that's really important. And poverty cripples people's health. That's really unfortunate. There's links with the government. Obviously, the CDC is linked with the government, or is run by the government, I guess I should say. Grounded in science. Are we making public health decisions based on evidence, which is extremely, extremely, extremely important. You'd be surprised, and we'll talk about this, how little medicine is actually grounded in science and grounded in evidence. So we're going to talk a lot about that. Big focus on prevention, obviously, and I'm not going to read through all these. I would suggest that you do, because this is important. Value of public health mobility. And this is from the CDC, actually, the 10 great public health achievements of the 20th century. I always thought this was kind of cool. Number 6, I think, is a little questionable, safer and healthier foods, just because in the past 30 years especially, in the past 30 years, we've seen an obesity epidemic. So I'm not exactly sure how they can claim that we have safe and healthy food when we're in the midst of an obesity epidemic. But I guess it is what it is. We've done a great job with number 7, healthier mothers and babies, as long as they have access to insurance. Otherwise, we have a pretty bad problem with infant mortality rate in this country. We'll take a look at that. Again, I'm sorry, number 10, tobacco is a health hazard. It's great. We've done a great job here in the U.S. with tobacco. And 50 years ago, almost half the population smoked. Now we're down to about 19%. But other parts of the world, everybody smokes. 50% of the men in the world smoke. 50% of the men in the world smoke. So that's a pretty big problem. These are just some additional resources that you can check out. And then there's one more presentation I want to look at. I apologize for the length of this. I'm going to kind of go through this as quickly as I can. Again, I'm not going to read through all this. I know that there was something here I wanted to look at. Give me 1 second, please. So as we've seen, crude and age-adjusted mortality trends in the United States. So basically, our life expectancy is increasing, which is good news. And we've done a lot of work on trying to expand our life expectancy. So in the past couple years, so this latest information is 2010, it has still gone up a little bit in the past 5 years. What they found, though, is that even though the life expectancy has increased by about a year over the past decade, there's another statistic called the healthy years life expectancy, so how long you can expect to live without disability or disease, that actually decreased by a year. And again, probably related to the obesity epidemic, so something to take into worldwide, and we rank number 27th. So we rank 27th in the world as far as life expectancy is concerned. As far as infant mortality rate is concerned, it's even worse. It's like 30th. So there are 29 other countries that are doing a better job of keeping their babies alive than we are. So the main reasons that we're so is primarily due to the economic gap. That primarily, especially for infant mortality, the biggest cause of infant mortality in the United States is poverty. Um, so again, that all goes back to social justice. Again, I think I'm going to kind of go through these pretty quickly. Measuring health, obviously a lot of different things that we're going to look at: mortality rates, morbidity rates. Again, morbidity is just a word for illness. So morbidity rates. What is the morbidity rates related to heart disease? What are the morbidity rates related to asthma, for example? So and all this information is collected by the CDC and other sites as well. We talked about the social ecological perspective and the multiple factors and pathways that may influence health, various risk factors. We'll talk a lot about risk factors in this class. Social and cultural determinants, social status, um, global health influences, again, population, pollution, poverty, all those things are really important. So things that we need to consider, and challenges that we're going to have over the next 50 years. Tobacco usage, again, due to major um, public health interventions, tobacco use has declined significantly in the United States. But unfortunately, the tobacco companies just went out and marketed to everybody else in the world, and especially in Asia, a lot of people are smoking. Um, as far as the determinants of disease here, I don't know exactly how they come up with this 48% behavioral, 16% genetic. That sounds a little bit too exact for my. I think it probably varies for person to person and culture to culture. But certainly those things all play a part. Again, just another flow chart. I'm going to let you kind of read through this on your own, but a lot of different things can influence our health and wellness. Poverty, of course, is extremely important. Smoking, important. High school education, believe it or not, education is a very good predictor of health. The more education you have, the better health that you tend to enjoy. But that is probably because the more education you have, it's probably related to how much money you have. So I think the education piece is probably just a reflection of overall wealth and income level. Um, Drinking, obviously, race, obesity, overweight, all these things are extremely important. Again, I think I'm going to skip over this. Cost benefit analysis. You will be doing something like this for your final paper, your final public health project. I did put in a cost effectiveness analysis for the example that I posted, and I will post a couple other examples as well. But you want to make sure that your public health intervention is actually worth the money that you're putting into it. And there are plenty of examples of public health interventions that cost a fortune and did absolutely nothing. So cost effectiveness is really important. Healthy People 2020, you've probably seen this before. It's great, they come up with all these great goals for which they're hoping, Americans, and not just Americans, but the rest of the world, meets these goals. They do this every 10 years. I think there was a Healthy People 2000 and then another one in 2010 and then another in 2020. Every year we fail to meet these goals, unfortunately. So we are getting a little bit better, but unfortunately we're not getting anywhere close to meeting these goals. But it's certainly kind of cool. Public health intervention anyway, or public health plan, I guess I should say. So the 4 goals: attain higher quality, longer lives free of preventable diseases, disability, injury, and premature death. Achieve health equity, eliminate health disparities, improve the health of all the groups, create social and physical environments that promote good health for everybody, and promote quality of life. So, these are great, and I don't see why these should not be attainable. I know, at least from a personal perspective, I've done a lot of things that adopted a lot of the recommended behaviors to make sure that my life is at least, and my family's life is meeting these 4 goals. And it's not hard, it's just a matter of being mindful about it. And then again, some additional resources. So that was that, and I think those were all the chapters. I'm sure you're probably going to have plenty more questions about the the final paper, and I will be sure to provide that as soon as I can. Okay, I hope this was helpful, and feel free to email me with any questions. Thanks.